Go.
Okay, right now I'm in the medication room. The patient, Rena Tract. I just got an order in. She has a UTI, and so I'm gathering supplies to start her on an IV drip, continuous. It's 125 milliliters an hour, and that is labeled with her name, first, last name, date of birth, and then on the back I'm checking for the expiration date, and the expiration date looks good. It's not cloudy or anything. And then I'm also going to be pulling up, we have her right here, her antibiotic. It's cefalozolin, and it's also labeled here. Expiration date is good on that, and that's going to be infused with the calculations and everything that will be infused. It'll be at 6 drips per the 15 seconds. So over a course of a half hour. And then also going to be doing, she's going to have an IV push. Last time she had some nausea with the medication, with the antibiotic. So I'm going to be giving her an IV push as well, and that's Ondansetron, and it came in, it was 2 milligrams per milliliter, and it's for 4 milligrams per 2 milliliters. And that's going to be given to her as well, so she doesn't have any nausea. Okay, and so now I'm going into, let's see, I'll go into the patient's room. Okay. Hi, Irina. My name is Jessica. I'm going to be your nurse today. Just doing some hand hygiene. I see you have a couple medications that came through for your UTI. And it looks like last time in your chart. And I'm going to check her name, date of birth. It is her. In her chart, she does have an allergy to mangoes. So I'll be, so you're going to be getting your medication today. It's an antibiotic, and it could cause some nausea like you had last time. So we do have a medication for you that will make it so you don't have any nausea today, and that I'll be giving that to you. Okay, and so here is the medication for that. I did hand hygiene. I'm going to be pulling.
And also seeing the patient for a little bit.
Then I'm going to get the alcohol swab.
And then after that, I'll make sure to set my alarm for 30 minutes.
And I'm going to clean for 30 seconds and wait till that is dry.
30 minutes has gone by. This is now.
And then it's for 2 milliliters, 4 milligrams. So I'm going to pull 2 milliliters.
And I'll change it to 5 drops
Air to inject. And then I'm
Adjust
going
it,
to
watch
pull
this one, and I see that it is
2 milliliters.
for 15 seconds. And then making sure that the patient is okay. I'm not having any reactions from arm or demeanor.
And that's just a little
I will
bit.
make sure the patient is
Deadline for videos until Friday.
Okay, we have that. So now I'm going to inspect the IV site. I'll do hand hygiene again. And it looks like the IV site looks good. There's no warmth to touch. There's no redness, or it doesn't look like any signs of infiltration. And so we're first going to like that. And before I do that, This medication here is also labeled with her name and then the date, right dose on there. Okay, and I'll get an alcohol swab. I'm gonna clean this off here for 30 seconds. Make sure just get the sides as well. Really clean that off there. And then I would let that dry. This is going to go in at a milliliter a minute. And just kind of make sure that's, there we go. And kind of with the pulsing actions, not to irritate veins. So I would do this at a minute, milliliter a minute. And I take that off. Now I'm going to administer the medication, and that was 4 milligrams. That was 2 milliliters. I throw that in the sharps.
How do we get more? Might need a new one.
This needs to go a little bit slower, so at least, very least a minute, and could at a rate 4 to 10 minutes would be ideal. Slower the better, not to irritate the veins. And I'll throw that away. And then we'll flush again, and this is going to be at the same rate as the medication.
When we're dosing hamsters, it's not fun. So being able to like identify what are we
I am going to lock this on the last
in this situation, we are
and then toss that. Okay, and then next I'm going to be setting up the primary, and that is labeled on here. And this is 125 milliliters of normal saline. And that's going to be at a drip rate of 5 drips per 15 seconds. I'm going to spike and prime the bag. Okay, and it is labeled on the back, and I'm also going to label the tubing. And label the tubing on here, go up toward the top. And this is good for 72 to 96 hours. It needs to be changed depending on the facility. Okay. And then this is locked. And then I want to open it up. And then you have halfway. this is, the tubing is not, the tubing is kinked. Okay, so this should be dripping and it's not. Everything's unlocked and open, so. Okay, it's slowly going through. Okay, here we go. There we go. Now it's coming out. Okay, so we'll lock that. I'm going to have an alcohol swab here, and I'm going to clean off the IV site. And this will be cleaned off for 30 seconds. Cool 30 seconds, and the outside as well. And then have that dry, and then I would attach the primary line. Okay. And then I'd have the primary line going, and that's going to be at a drip rate of 5 drips for 15 seconds. Get going. Because the line is kinked, it should be going. It would be at 5 drips per minute. 5 drips per 15 seconds. Okay. Now I'm going to prime the secondary line, and this is for antibiotics. And so I'm going to grab that. I'm going to spike the bag. This is for the piggyback. Spike the bag here. Pull that off. This off here. And spike the bag. And I'm also making sure that it is the right prescription, right strength, expiration's good, it's right patient, right route.
What is the part in our chat? What is the MRM? It's medical record.
And then I would label this. I would label this, and it would be at, I'll make sure that this is locked, and I would make this gets changed every 24 hours. Okay, I'd get another alcohol swab. And I would clean off the primary. Clean this off. 30 seconds. So that is dry.
You ready?
Here we're going to back prime.
Okay, I'm in the medication room. I'm going to check that. She got UTIs with that, and her lab showed that from the
Pain. The primary line lower. And we're going to infuse the secondary line over
the notes from the doctor
a half
that
hour.
she applied for it. A normal setting for like 125 minutes more per hour, and she got
That up.
Cefazolin for the infection, and then she got aldosterone for infection.
And I would set that at a drip rate, and that would be for the secondary line, it would be 4 drips for the 15 minutes, and that would go for a half hour. I'd set a timer, and then I'd come back and check and make sure, and then reset up the primary line back to the 5 drips per 15 seconds. And so I set a timer. I make sure that the patient, she has her call light, the bed is lowered. I'd ask her if she needed anything else, and I would go and chart.